let's go ahead and get started with our event. So today we're going to be talking about long haul COVID. I'll go ahead and let Mary introduce the information, but basically we are Paloma Health. We are an online medical practice that focuses and treats hypothyroidism. And I'll go ahead and toss off the hat to Mary to go ahead and introduce us. Just quick announcement, if you have any questions for our doctors, go ahead and feel free to leave all of the questions for our live Q&A in the community where we are live streaming the event. And without further ado, it's Mary Showman.
Okay. Well, thank you so much, everyone, for joining us today. We are really excited to have Dr. Jacob Teitelbaum and Dr. Andrew Cunningham here to talk with us about some of the implications of long COVID, also known as post-viral COVID syndrome or post-COVID syndrome. And we're going to be talking a little bit about that and the relationship to your thyroid health and to autoimmunity and the various factors that come into play here. And I'm going to start out by introducing Dr. Jacob Teitelbaum. And after Jacob gives us a little bit of an overview of his approach to things, and we'll be introducing Dr. Andrew Cunningham. So I am so thrilled that Dr. Jacob Teitelbaum is with us today. He is an integrative physician, an author, a researcher, an educator, a teacher, a grandpa, and has just, I've also known him probably close to 20 years now. More. And I think it's been that long. And he has always been consistently one of the most amazing integrative physicians who bases his information in science. It is always coming from a place of integrity and a place of incredibly valuable information. He's one of the most frequently quoted integrative pain and fibromyalgia authorities in the world. He is considered really one of the top experts on fibromyalgia and chronic fatigue syndrome in the world, and has written so many amazing books related to that, including the book that I consider a standard on my bookshelf, which is From Fatigue to Fantastic. How many? There's been 3, 4, 5 editions of it. I have every edition of the book on my bookshelf. And always, but every time a new one comes out, I buy it because he's always got some great new information. There's a book called Pain Free 123, The Complete Guide to Beating Sugar Addiction, a really helpful book for a lot of people. Real Cause, Real Cure, The Fatigue and Fibromyalgia Solution, Diabetes is Optional, and the popular smartphone app Cures A to Z. When he's not doctoring, writing, researching, and probably surfing, he is the lead author of 8 studies on effective treatment for fibromyalgia and chronic fatigue. And I'm going to throw in really post-viral sorts of conditions. He's done some research into post-COVID and effective treatments for post-COVID. He studied treatments of autism using NAET, which is a really cutting-edge, holistic approach to dealing with autism and allergies and a variety of other health conditions. He has been on pretty much everything you can imagine. Dr. Oz, Good Morning America, Oprah and Friends, CNN, Fox News Health. You've seen him everywhere. He has vitality101.com and endfatigue.com are his 2 key websites. And so it is my pleasure to introduce Dr. Jacob Teitelbaum, who is going to just tell us a little bit about why he's joining us today to talk about post-viral syndrome, post-COVID syndrome, and the thyroid community.
Well, thank you, Mary. And I would note that Mary is one of the most respected, if not the most respected, thyroid experts in the world. And in terms of being a teacher and an educator, yes, in terms of being a teacher and an educator, she's reached more people than anybody else I know. And I was happy to make my new friend Andrew yesterday when we got a chance to speak. So I look forward to getting to know you better too, Andrew. A lot of folks ask, what's a nice doctor like me doing in a field like chronic fatigue syndrome, fibromyalgia, chronic pain? These are things that you kind of get blown off in medicine if you do that. They're not popular areas because they're all just crazy people. Even though the research is very clear that these are very real illnesses. I know hysterical paralysis, which we now know is multiple sclerosis. was treated as a neuroses for countless years by medicine. And we're doing the same with hypothyroidism, with fibromyalgia, post-viral chronic fatigue syndrome, and the rest. I got into it because back in 1975, when I was in medical school, I came down with a nasty viral infection that left me non-functional 6 weeks later. And since I was paying my own way through medical school, I had to drop out of medical school, and I was homeless, sleeping in parks, because the professors couldn't figure out what was wrong. They figured after a while, well, the virus should be gone, so he must be having med student depression. And it was being homeless in park benches in Tulsa, where I would meet multiple different people who taught me bits and pieces of the healing arts, in terms of herbal medicine, Eastern medicine, energy medicine, a host of different things. And I was able to cobble together an approach that got myself well, went back to medical school, got my honors in medicine. I spent the last 45 years or so focusing on making effective treatment available for everybody with unexplained fatigue, fibromyalgia, chronic fatigue syndrome, and post-COVID, which is simply post-viral chronic fatigue syndrome.
Thank you. What a story. I think sometimes the doctors that have been through really difficult situations are often the ones that are best able to really dive in and relate to the patient experience. So let's introduce Dr. Andrew Cunningham, MD. He is board certified in family and integrative medicine, and he is one of our Paloma Health doctors. Dr. Cunningham operates out of Colorado, as we mentioned at the beginning. He received his BS degree from the University of Virginia before he returned to his hometown to receive an MD from the University of Louisville. His residency was done at UCSF Santa Rosa. So he is a family practice physician with extensive experience managing thyroid disease as well as other autoimmune conditions. He's primarily practicing virtual medicine right now, currently from Denver, Colorado. And prior to relocating there, he was the clinical lead at a primary care office in San Francisco. So Dr. Cunningham, Andrew, welcome. We're thrilled to have you. And I know Paloma is thrilled to have you on the Paloma team as well. And why don't you share a little bit about why you're here today to talk to us about post-COVID, post-viral issues?
Yeah, thank you. I'm delighted to be here, and it's really nice to to be having this conversation with you, Jacob. And I want to pay a little gratitude to you for paving the way of helping with complex medical conditions that Western medicine and medical school doesn't really give us a very good framework for when we're learning in the classroom. I know when I was first had my own panel of patients coming to see me, and people are coming with chronic fatigue and things like that. Your work was, a really good source of truth for me to dig in deeper. So appreciate you working on the 1,000-piece puzzle and not the simpler 100-piece puzzles. So I practiced primary care for a while. Coming out of residency, I was interested in integrative medicine before I went to medical school. Grew up in my teenage years reading Andrew Weil's books and got very interested in herbal medicine and kind of knew that was going to be a big part of what I wanted to do career-wise. And then in my sort of continuing education throughout residency and thereafter, and going to functional medicine conferences and so forth, there were always talks about thyroid, and recognized that this was a condition for which a lot of people were not very satisfied with their care, and there was a lot of nuance in it. And I'm drawn to things like that as well, like gut health, IBS, sort of multifactorial challenges that people can work their way through and get over. And I've been seeing patients at Paloma here for about 3 years now, and enjoy it more every day, and continuing to learn ever more about all the nuances of doing hypothyroidism. So I'm happy to be here. Thanks.
Wonderful. Thank you. Well, this is going to be an absolute all-star panel discussion here. So today we're going to be talking about the implications of long COVID or post COVID syndrome. It goes by a number of different names, long haul COVID. There's a variety of different ways to describe it. I don't really need to, I think, go through a big overview here of what COVID is. People know what COVID is. COVID is the disease caused by the SARS-CoV-19 virus. And we know that it has been around since early 2020. For the most part, it's gone through multiple mutations. Symptoms can be as simple as like a cold, a little cough, a little fever, a little chills, and they can go into very dramatic levels of symptoms with loss of low oxygen, loss of taste or smell, and they change as we get through the different mutations. So it's been a situation in flux for a lot of people. Some people seem to recover and do fine afterwards. Other people have been struggling with symptoms for weeks, months, and now that we're at the 3-year point, there are people who have actually had COVID very early on in the course of the pandemic and are still struggling with a long haul or long post-viral version of the condition. And that's what we're really focusing in on today, is this concept of long COVID, these symptoms that continue. So my first question, we have a number of questions, and I would like to remind you, if you do have questions for everyone, please put them in your chat box, and we will be having a point after we get through a few basic questions. We will have a point where we will go to your questions, and we will try to stay as long as we need to cover all of your questions. So please feel free to ask anything that you really would like to cover. But our first question that we have is going to go to Jacob. And Jacob, can you tell us, just basically give us an idea of what long COVID is and how common it is, and what sorts of implications it's having for people in terms of their health and wellness and quality of life?
So it's important to understand definitions. The current definition for long COVID or long haulers is dismal. It's any symptom persisting after COVID for more than 3 months. So if somebody had a stroke, or they had a heart attack, or they have post-viral chronic fatigue syndrome, or loss of taste and smell, it's all being lumped together. And it really needs to be unlumped because the treatments vary from aspect to aspect. So our focus today will be on the persistent fatigue, brain fog, often pain that will go after the long, and that's a post-viral chronic fatigue syndrome form of long COVID. That's what most people are talking about with it. I will, for those of you listening, my email address, if you want, there's a 4,000-word information sheet that will go through each organ system and the long COVID for all the other things, what you do. And my email is fatiguedoc@gmail.com. They're free information sheets that'll talk about orthostatic intolerance, if you have heart disease or stroke, or how to treat the different components. But I want to focus on the part that relates to the thyroid today, which is a chronic fatigue component. We're looking at about 10 to 15% of people post-COVID are having these persistent chronic fatigue syndrome, fibromyalgia-like things. The vast majority of people with a post-viral or other forms of fibromyalgia also need thyroid treatment, regardless of what the tests show. And when I say need, how do you know they need it? Because when you give it to them, they get better. That's my definition of they need it.
Mm-hmm. Okay. What type of, in addition to the sort of persistent fatigue and brain fog and sort of body aches, myalgias, the fibromyalgic like symptoms, are there any other characteristic symptoms, Jacob, of long COVID?
Yeah, about 100.
Well, yes, of course. I mean, we know that there's there's so many different, but I mean, one of the things that I've heard a lot of people describing is sleep disruption post-COVID.
So here's the thing. When you get the post-viral chronic fatigue syndrome from COVID or from anything, what you're getting is suppression of a key circuit breaker in the brain called the hypothalamus. That controls sleep. Now, you won't always see it in the beginning, in the first 6 to 8 months, but over time, inability to get restorative sleep becomes a hallmark. You're going to see orthostatic intolerance, where you stand up, you may get lightheaded, your pulse goes up 20 to 30 beats a minute. And oddly enough, in the post-COVID, we're seeing not just the pulse goes up, but the blood pressure goes down. We're seeing that component. If you ask me for the information sheets, I'll send you how to do home testing for orthostatic intolerance. But again, this circuit also controls your entire hormone system. So you're going to see your thyroid is going to be off despite normal testing. This is what the research shows. If you look at research by Professor Neek and Professor Rydell, they're showing that fibromyalgia routinely has hypothalamic dysfunction, and that the TSH, I asked him point blank when we were both lecturing at an international conference in Italy, and I asked, is the TSH reliable in fibromyalgia? And Professor Neek said, absolutely not. It's meaningless to use that test when you have that circuit breaker which controls TSH not working, that hypothalamic circuit breaker. And that's why I tend to be so adamant, pain in the ass, pick your word, about you've got to treat the person's symptoms and not only the blood testing.
Cool. Thank you. Andrew, we've got certainly there are a number, I mean, with the numbers of people that have hypothyroidism are so large in the United States, and the the sort of intersection of that group with people who have gotten COVID, is increasing all the time. Are there symptoms that people with hypothyroidism are struggling with that may make us more susceptible to long haul COVID? If we have autoimmune Hashimoto's, are we more susceptible to getting long haul COVID? And among our thyroid community, are there people within it that are more at risk of developing long COVID, particularly? So kind of a three-part question. You can tackle it any way you want to.
Right. I'll just jump in, and I may forget some components of that specifically, but a couple of things I'll reflect on. One is most of us here don't have all of the expertise and opportunities to manage sort of post-viral fatigue as Dr. Teitelbaum has over his long storied career. So we probably don't see as much people coming to us for long COVID because in sort of inclusion criteria of being cared for within Paloma is sort of have you been diagnosed with hypothyroidism, and how is it being managed and everything at our intake point. So what I would say is I definitely have had folks that I've been taking care of their thyroid who have developed long COVID here, and there are a lot of overlaps. Absolutely. For example, vitamin D deficiency, we know is an increased risk for all autoimmunity, basically. Well, it also, received a lot of press for its implications with COVID. And a lot of people started actually wanting to get their vitamin D levels tanked up when they realized that they might be more predisposed to getting long COVID. Yeah, I mean, I think previously many of us took vitamin D. I think people became a little bit more interested in finding out like, oh, okay, what is my status? Get me into an optimal range. I don't want to get long COVID. But yeah, I mean, we know that viral infections are one of the environmental triggers for autoimmune conditions, the others being genetic predisposition, and there are a lot of different environmental triggers, the gut immune interface and how the immune dysregulation can happen through that. But I think COVID, absolutely, like we're going to end up seeing it being one of one of the viruses that ends up being, part of our understanding of these like prolonged things for a long time, just as EBV and, other herpes viruses have been over time. So to answer, I don't think that answered any of your specific questions, but I think of, helping people through the autoimmune form of hypothyroidism. There are a lot of overlaps in the strategies for managing that as there are for post-viral fatigue in terms of, really trying to help the body's stress response. So stress reduction, keeping cortisol levels, on a good rhythm, restorative sleep, dietary guidance that helps keep immune dysregulation under better control. I think you probably would love to contribute some to this also, Jacob.
Well, I would note that the low adrenal because remember that circuit breaker called the hypothalamus that gets clicked into hibernation mode with these viruses controls thyroid, but also controls adrenal. And the testing again is dismal. The way that I diagnose low adrenal is, do you get irritable when hungry? And if you're not sure, ask your spouse or those you're living with. And if they, I'll ask the wife, and they're going like, yeah, he does or she does, like that. And there's a nice simple treatment. I mean, increase salt, cut back to sugar. There's adrenal supplements that have glandulars, licorice, and vitamin C, different the pantothenic acid. I like one called Adrenaplex. It smooths the moods and the energy right out. But that adrenal function, as you're alluding to, Andrew, is critical for immune function. If it's low, you're going to see more autoimmune illness. You're going to see post-viral is going to be low, and it's going to throw off immunity. I see people come and they say, I get every infection that comes by and it takes forever to go away. I ask them, first question is, do you get irritable when hungry? And they go, yes. And I say, here's the adrenal support. And they come back next time. I say, everybody else was sick all winter. I didn't get a thing. That adrenal support is critical piece. And especially if you're advancing thyroid dose and they can't tolerate a dose they need, it's often because their adrenal is low. Optimize the adrenal, and then they can tolerate the thyroid. Optimize B1, 500 3 times a day milligrams. That also helps after 6 weeks. But the adrenal, critical component here, along with the thyroid, to allow optimal treatment of thyroid.
Yeah, that's really interesting. I mean, I would echo the importance of that. And I also don't usually check people's salivary cortisol rhythms because I use a lot of adaptogens in my practice, and they don't force things in the wrong direction. I mean, they're just going to modulate things back towards normal. There's thousands of years history of using ashwagandha and ginseng and rhodiola and eleuthero and these other adaptogens that are I think an important part of immune resilience through this flare of respiratory infections that we're all globally living with right now. And those things help people with autoimmunity, and they help the rest of us who are just under general stress and traveling and not sleeping enough and that kind of thing.
Well, since you bring those up, there's 4 studies I've completed on effective treatment of post-viral chronic fatigue syndrome and fibromyalgia in the last 2-3 years. And the one on using a special form of ginseng, most ginsengs had lost potency because they got so expensive, and then they got farmed out. You need the wild ginseng, so other ones don't work. But using a HRG 80 red ginseng, we saw about 60% of people with post-viral chronic fatigue syndrome improved, with about a 60% average increase in energy. Wow. Ashwagandha and rhodiola, we did another study using a combination of those with ribose, and what we saw was 89% increase in stamina in the study in the chronic fatigue syndrome fibromyalgia. So exactly what you're saying, these adaptogens are critical, but they're not expensive, so most doctors will never be taught about them.
Ashwagandha is definitely having a moment now, though.
Yeah.
Good reason.
The interesting
thing, exactly.
The interesting thing to me here is to sort of reinforce the picture here, because Paloma's a practice focused on hypothyroidism. So the Paloma patient population is Hashimoto's and hypothyroid patients. They may have other conditions and other health challenges, but those are the 2 conditions that the Paloma practitioners really are focusing on. Jacob's world is sort of the post-viral syndromes with chronic fatigue, fibromyalgia, but the hormonal balance, the sex hormones, the thyroid hormones, the adrenals are part of the bigger picture treatment approach for what Jacob is looking at, just as they are part of the big picture treatment approach for thyroid patients as well, as Andrew is pointing out. If we don't look at the adrenals, if we don't eat well and focus on gut health, if we don't get the proper sleep, like Jacob was talking about, if we let the hypothalamic disconnect continue, your thyroid isn't going to feel better. And your post-viral issues, your fibromyalgia, your chronic fatigue, none of those things are going to get better. So there is such an amazing crossover here, which is why we're so excited to be talking about this. And Jacob, for people who may not be familiar with it, and we have some articles up at Paloma about it, but what is the connection between chronic fatigue and fibromyalgia and thyroid issues? If you can give us that in a nutshell.
Yeah.
It goes in both directions. Anything that drops energy when your body is under stress is more likely to trip that hypothalamic circuit breaker. And low thyroid certainly leaves you in a low energy state and more likely to get the chronic fatigue syndrome of fibromyalgia, to trip that circuit breaker. Then on the flip side, once you flip that circuit breaker, that hypothalamic pituitary controls thyroid function. So suddenly you're going to have not just you're going to get a drop in thyroid function. Beyond that, your body is registering low energy. It's going to put you in a almost hibernation state, turning your thyroid into reverse T3, which makes your symptoms worse. You're going to have difficulty converting and the T4 to the active T3, making your symptoms worse. And that's about as much as I can fit in a nutshell. But it's major interaction.
Okay. Andrew, there we've been focusing primarily on the fatigue and exhaustion and pain elements of the long haul COVID or the post COVID syndromes. Can you give us a little bit of a rundown about some of the other implications for people's organs? Or I know I have friends that now have permanent lung damage and heart issues and some other things. Can you just give us a little bit of a rundown of some of those sorts of implications that people might be facing with long COVID?
Yes, absolutely. I mean, I hopefully they can be optimistic that some of that damage might not be permanent, because I think the time periods of the damage, the collateral damage that the respiratory viruses and the cytokines and everything are causing is still being elucidated. There's a title that is being used in the medical literature now for long COVID, which is PASC, which is post-acute syndrome.
Like
And
COVID.
I mean, it doesn't have a ring to it at all. So I think long COVID is fine. Everybody knows what we're talking about when we call it that. But in what I've seen is, right, cardiac. I actually wrote down some percentages of like some of the downstream organs affected. I think cardiac and post-COVID can be mid 30%, renal 25%, respiratory probably 30% ish, sleep, and mood dysregulation, anxiety, things like that is pretty high, like 40% probably. And then you have digestive manifestations and musculoskeletal stuff that's kind of like lower down. Certainly, there is a big gut important component here, which I'll just sort of crack open, but I don't really know how to put this all together. But I mean, everybody's individual microbiome is also impacting how their immune system is managing the infection and recovery as well from that. So it can affect a lot of different end organs. But I think the ones at least in my world, doing mostly autoimmune, thyroid, gut work, and I don't work in ICU, and I'm not a pulmonologist or anything. The brain fog and the fatigue, like this is kind of the stuff that is really affecting people's quality of life a lot, that I think we have interventions that can help. I don't have being earlier in my career, maybe not as bold yet to feel comfortable quite saying, why don't we trial thyroid replacement in the setting of normal labs and known long COVID or something like that. So, it's great to speak to Dr. Teitelbaum about this and sort of get his take on it, because he has so much experience with it. So for me, this collision of these worlds is kind of just coming together, and I'm mostly encouraging people to focus on the usual things that I would tell most people with autoimmune to focus on: anti-inflammatory diets and so forth, and then trying to figure out, like, if there are things that trigger their autoimmune system. I mean, there are autoimmune symptoms. Those are things that are probably going to impair their recovery as well.
Good point. Very good point. Well, let's segue that into the good news, which is that there are some effective treatment options. I mean, all we hear in the news is you can't treat, you've got to take the vaccine and take the Paxlovid, and then you're going to get the rebound. And, and after, if you have long COVID, we don't know what to do. I have people, and so Jacob has come up with a protocol, which he has been working with patients on, and that they're in testing and evaluation. And he's going to share with us some of the effective approaches for long COVID and the percentage of people that are recovering or improving on this protocol. So
what our published randomized double-blind placebo-controlled study showed that fibromyalgia and chronic fatigue syndrome, including post-viral, if you do an integrated protocol to increase energy production, it's called the SHINE protocol. You optimize sleep, hormones, including especially thyroid and adrenal, address other infections, candida, SIBO, and a host of other infections, give nutritional support. I'm not talking about a one a day. I'm talking about really solid nutritional support, and exercise is able, not too much exercise because you'll be bedridden for 3 days, but just enough to maintain conditioning. 91% of people improve with an average 90% increase in quality of life. This is incredibly treatable. As I mentioned, we've completed 4 studies on effective treatment in the last 2 years alone, looking at the HRG80 red ginseng, looking at a mix of nutrients like ashwagandha, rhodiola, things like that, and some things that aren't yet available in the United States. But understand, most doctors get virtually all of our medical information from the drug companies, and the media as well, which means what we will hear about is what's expensive and profitable. If it's cheap, I mean, we were talking about vitamin D. How many people know that Dr. Fauci says he takes vitamin D for the COVID? Didn't see that in the newspapers. If he was taking expensive medicine, right up there. So, again, you have my email address, fatiguedoc@gmail.com. If you have shortness of breath as part of your long COVID, also ask for the shortness of breath information sheet. But the overall information sheet, the orthostatic intolerance sheet, because this goes pretty wide afield, where we want to focus on thyroid today. But it will go through and say, here's how you recover. My book, shameless plug, From Fatigued to Fantastic, will make you an expert.
Well, and I would like to add too that I have known a number of people that have had various post-viral conditions that have gone. And at one point, I remember, Jacob, we sort of used to say thyroid, hypothyroidism, fibromyalgia, and chronic fatigue are all sort of manifestations of the same underlying mechanism of problem. And so when we look at post-viral issues, Jacob's been doing this work for decades in chronic fatigue, fibromyalgia, and post-viral work after people have had various types of viruses and things. But this means that what we're dealing with in terms of long COVID is not new to you, Jacob.
I've been doing this over 45 years.
Exactly. So everybody thinks, oh, it's a new virus, it's a novel coronavirus, etc. But what it does to the body, what it leaves behind, is not new at all. It's the same old story from Epstein-Barr and HHV6 and all of the different viruses that people have been getting for decades and decades, correct?
And for other acute respiratory viruses, that we've been seeing lately, we've been seeing the lung damage, and we know that lung damage improves on its own over time. I will add special forms of curcumin called Curamed that are highly absorbed. I will add glutathione that's highly absorbed. There's ways to turn off the antioxidant and the free radical blast that comes from the virus. This is old stuff. It's just what's lacking is not effective treatment. What's lacking is effective physician education. These are all very, very treatable. And again, even though we focused on the fibromyalgia piece, even if you have the brain fog, very treatable. If you have shortness of breath, ask me for my information sheet on shortness of breath and long COVID and CFS hypo. If you have the heart disease, in general, heart failure is incredibly treatable, but your doctor's toolkit is only a tenth of the whole toolkit available. When you start using ribose, you start using coenzyme Q10, you start using the B vitamins, magnesium, all these things dramatically increase cardiac function. Even in people near deathbed, levels of CHF can improve dramatically. But these are cheap, so nobody is teaching us about them as physicians.
Mm-hmm. Andrew, before we're going to go over to our Q&A because we get questions coming in from our viewers, and they've got a lot of really great questions. But before we move on to those questions, can you address whether or not people who have hypothyroidism or Hashimoto's, so we're going to assume most of us, I fall into that category, are on some form of thyroid hormone replacement if we've been diagnosed and have a longstanding situation. Do we need to be aware of any particular concerns about the way we might be getting care for COVID or for long COVID or in interactions and medications? And you know, I'm going to throw that to you, and then we'll let Jacob jump in on it too, because he's also managing a lot of patients that have both hypothyroidism and long COVID and other types of post-viral issues. But what do we need to know as a thyroid patient, just so that we're not walking into a minefield here?
Yeah, I think that, you know, we are going to see dysregulation of the testing after illness or during illness. I mean, when I was, you know, working in the hospital in residency, like we would never check people's TSHs when they were in the hospital because we were going to get a lot of false positives, and it wasn't reliable, you know. So I think that it is going to be hard to really know like how to deal with the testing if somebody is acutely sick. So I don't really want to encourage that we over test during that period. And I think you would agree with that, right, Jacob? Like it's the hypothalamic dysregulation of an illness is going to.
I think the tests give 10% of the answer. The vast majority of people who need thyroid support have normal tests. But you'll see this, the normal is 95% of the population. So if you have 0.9 to 1.8 being the normal range for the free T4, you'll see them all hovering about 0.93. They're in the lowest 5% of the population. They're tired, achy, weight gain, cold intolerant, have unexplained infertility and miscarriages, and all these symptoms that make them poster children for low thyroid. Mm-hmm. And the doctor's saying, no, you're in the 3rd percentile, not the lowest 2.5%. Sorry. It's like, you know, I'm going to treat them. And I'm not.
But it also means that not all of them need more medicine, right? Because like you and I were talking about, COVID can trigger hyperthyroidism symptoms in some people too. So we really have to listen to the symptoms, and people need to speak up to their endocrinologists and you know, functional medicine doctors and PCPs about.
You just said
I had COVID. Okay.
And as is very rare in my life, I have nothing to add to that. You just nailed it. You got to treat the person and not just a blood test. And you need to see how they respond to treatment and adjust it that way.
Well, and as a thyroid patient, I'm going to say too, anytime you have any sort of illness, and it doesn't have to be COVID or long COVID, it can be a respiratory infection, a flu, even if you have had an injury, you broke your ankle or you've had a surgery for something, tonsillitis, you always need to pay attention, because that inflammatory situation, any sort of illness that you have, that is going to, in some cases, destabilize your thyroid. So I always tell people, watch your thyroid function after an illness, after a great stress, after a surgery, because those
after pregnancy.
Pregnancy, of course, obviously, that's one of the rings. During menopause, during perimenopause, periods of hormonal change, higher infection, or injury and stress to the body are always going to be points when the thyroid can get more dysregulated and need to be adjusted and paid attention to.
And Andrew, let me add one other thing too, because you're saying, well, it could be high thyroid or low thyroid. The TSH won't tell you. The TSH can be high or low, and either way that it goes. The free T4 and symptoms will tell you. If the free T4 is in the upper 10% of the normal range and the person is fatigued, I will consider hypothyroidism causing their fatigue. And again, so high T4, think hyperthyroidism. If it's in the low 20%, think hypothyroidism. Pretty straightforward if the symptoms suggest it.
Okay. I think we're going to jump over to questions from our viewers. First question, we've got a viewer who had COVID more than 2 years ago. So this was one of the earlier COVID patients who developed an underactive thyroid afterwards and chronic fatigue syndrome. said my TPO antibodies were very high when first diagnosed, but they have since dropped. Do I have Hashimoto's? Is this considered Hashimoto's? And looks like, can my thyroid be permanently damaged from COVID, or is this something that's possibly recoverable?
Andrew, do you like, or shall I take that?
I can take a crack at it, and I'm really interested in your opinion. But sometimes people will get like a acute thyroiditis or like a subacute thyroiditis too, where they actually. I mean, I've had patients that I met through Paloma who had acute thyroiditis, had their thyroid removed in the past, and then it was determined, that they didn't actually have any need for surgery, and basically had this self-resolving condition that for which they had their thyroid gland removed, sadly, and now require ongoing supplementation. But I haven't run into like that specific case personally, to know if that's Hashimoto's. Is that a form of acute thyroiditis? That, like, what's the prognosis there? So I'll pass that to you, Jacob.
So instead of worrying about the taxonomy and the name we're going to give, what label we're going to stick on it, I would say that your thyroid has been inflamed, whether it's an autoimmune specific Hashimoto style, whether it was a subacute thyroiditis. And you could do scans and uptake scans to kind of differentiate them. But the question I'm going to pose is, what difference does it make? And I'm not saying it doesn't, but I'm saying if the person has symptoms of low thyroid achy, weight gain, cold intolerant, I will be giving the thyroid hormone, adjusting it to the form and dose that feels the best to the person, while keeping the free T4 as the only test I'm really concerned about from going too high. I'm not going to worry if the TPO is high or low. Now, once I've done that, I will also address lifestyle issues, especially things like wheat and sometimes milk allergy that can drive Hashimoto's. And if the person's not improving, I will take them off milk and wheat, mostly the wheat, for a while, because sometimes that will improve their symptoms. I will do things to optimize immune function, such as the vitamin D, as you noted, Andrew, and the adrenal issues. But the first thing I'm going to do is to optimize the thyroid, and the way I tell it's optimized is because what is it? Are the symptoms better? What dose are they best at? And it's a free T4, not elevated, so to be on the safe side. The rest of it to me is, as I say, commentary.
And then you would monitor that situation and then like start to wean them off and see how their hormone responds over time, with the hope that they don't have a long-term need for it? Or
I'm not anxious to wean them off. I consider thyroid to be a supplement, a natural product, or a bioidentical at least product, that is simply replacing what is low in the body. And as long as I'm not keeping the T4 in the upper 20 to 30% of the normal range, I'm not overly worried about toxicity and side effects. You have to wean out people who have underlying heart disease and arrhythmia issues and the rest. But for most people, the time that I stop them is if they're feeling great and they're tired of being on it. I say, yeah, let's go ahead and see if you can wean down off it. And the way I tell is not by following a TPO and not by following the other tests. It's by how do you feel?
Sure.
On it versus off it. It's not rocket science.
Mm-hmm.
We like, Andrew, as doctors, we're trained, we want something in black and white. We don't trust our art of medicine. We don't want the person to even come in. If they just stay home and send the test, we're happier, because we've learned not to trust our ability to listen to the person. And what I'm saying is that we like things in black and white because we don't trust our art of medicine. But I will tell you, when I first started medical practice in 1980 in Annapolis, and I had my own office, first thing I would do is I would do a chemistry and a cholesterol panel on each person. Both of them had a cholesterol reading. This is at one of the major national labs. There's two national labs, national, I won't give their name. The cholesterol results routinely on the same tube of blood from the same person varied by 20 to 160 points.
Wow. Incredible. Did Jacob freeze?
I think he's his video froze for a moment.
Oh, Jacob, your video has frozen, so maybe you can
you see in black and white any more than
there
you
it
trust
is.
your ability to listen to the person and hear what they are saying. They know.
Okay, thank
Do
you,
they feel
Jacob.
better with it?
Your screen froze for a moment there, so we thought you were making a very, very dramatic point.
It was my rant for the day. I can't have a good day without a good rant. It's okay.
That's okay. No, the universe said we were going to stop so that everyone could absorb this incredible information that was coming into us. So,
Mary, you have a sense of humor. There you go. That's good. Thank you.
I have a question that came in from a viewer for both of you because, and this is one of those, there's a lot of old wives' tales and conventional wisdom that people share with each other. You shouldn't do this. You should do that. If you have Hashimoto's, you shouldn't take natural desiccated thyroid. And here's one: if you have Hashimoto's, you shouldn't take ashwagandha. And so somebody said, my understanding is that people with hypothyroidism and Hashimoto's shouldn't take ashwagandha. Can you talk more about this with post-COVID and Hashimoto's? Because obviously it might be a helpful adrenal support. So Andrew, can you give us your thoughts on that? And then we'll have Jacob weigh in on the ashwagandha controversy here.
Yeah, I think I know where the origin of this I think is related to ashwagandha's inclusion in the nightshade family of plants. And nightshade plants, which also includes tomatoes and bell peppers and eggplant and some others, are a known trigger for some people with rheumatic conditions and autoimmune conditions and things like that. So I think because there is a small subset of people who are sensitive to nightshades, this has been generalized that ashwagandha has kind of been, given a bad name among this. But I actually don't see a contraindication with ashwagandha in most people with hypothyroidism. I think the benefit is far greater than the risk. And if somebody has a known sensitivity to nightshades, then yeah, they may want to avoid ashwagandha. It's okay. There's a lot of great other botanical alternatives to ashwagandha in the adaptogen realm. I mean, milky oat, eleuthero. There's one of my favorite books on the topic is by David Winston, who's an herbalist, and he has a book called Adaptogens. I've got another textbook about adaptogens if people want to learn more about the nuances of which ones and their various applications. But yeah, don't throw the baby out with the bathwater, I think is sort of the takeaway on that. Do you agree, Jacob?
Andrew, I think you answered that question far better than I could. I'll go back to my original answer, which was,
okay, that works too.
What I'll say is, again, as Andrew is noting, that there's so much misinformation where things are taken out of perspective. Yeah. Anything can cause benefit or harm in anybody, depending on the case and the situation. So what I'm going to invite you to do as being responsible for yourself is see how things feel to you. How is that working out for you? If your body says there are very rare things, just treating infections predominantly, where you'll get die-off, and sometimes if I'm giving chemotherapy or things like that, where a helpful treatment will feel worse. For most treatments, if it makes you feel worse, your body is saying no, thank you.
So listen.
Now, adaptogens take a while to work, right? So don't take ashwagandha as needed, and don't expect it to make you feel better. Right, long time.
Yeah.
6 weeks to see the full effect. I mean, I know if I'll take the
more than a bottle.
ginseng, I take the first chewable tablet, and I feel it in under a minute. I'm pretty energy sensitive, so metabolically it should take longer. But there's a quick effect, and then there's the effect over time. So again, see what it does for you, see how it feels, give it 6 weeks.
So here's an interesting question. We've got someone who has Hashimoto's and is into day 66 with COVID, had taken the 4th shot and got COVID after that. It says, this person says, it gave me COVID. We know that may be questionable, but certainly there was a definite relationship between the period of when they got the shot and then developed COVID fairly quickly. To add to my exhaustion, I now have vasovagal syncope. Any ideas to get me through this? Jacob, this is definitely somebody up your alley, right?
Again, email me at fatiguedoc@gmail.com. The orthostatic, and ask for the free information sheets. The one on orthostatic intolerance, that's what the part of the vasovagal syncope. It's not really vasovagal syncope that you're having probably. It's orthostatic intolerance post-COVID. I will note I've treated a good number of people who have had long COVID triggered by the vaccine. I am not anti-vaccine. I think the four main benefits of modern medicine are vaccines, antibiotics, emergency surgical treatment like obstetrics and injuries and things like that, and toilets, so we're not throwing our poop in the street. Most of the other benefit things in medicine, kind of a toss-up over the
Can
board.
medicine take credit for toilets?
Yeah, so we'll take credit where we can. That doesn't mean that we should turn our kids into pincushions, and that it hasn't turned into a big business that ignores science and sanity. But so I don't have. I'm kind of an in between with vaccines. There's times where they're helpful, the time where they're not. Can they cause harm? Yes. If you're in the medical profession and you bring up the harm and you're a researcher, you will have all your grants disappeared and you'll be fired.
I think it's important to tell people not to over rely on vaccines as well, right? I mean, vaccines are not going to protect you completely. I mean,
not from COVID, not anymore.
No, and
right. So it's not. I mean, I doubt that it gave this person COVID, but I think that it doesn't offer full protection, and
yeah,
I've seen enough post-vaccine COVID cases. And I don't want to go through what the treatment that's effective because this is too controversial, the whole area. So I'm going to note that it is very treatable. I don't want to go into it here. It's just it's become so polarized that, but no, it may have been serendipity that they got the vaccine and got it, but I've seen too many cases. And again, I'm really for polio vaccine, smallpox vaccine, tetanus vaccine, 4 thumbs up.
I'm also want to say I'm not anti-vaccine, and I've had COVID vaccines, and I've had COVID, and I have hybrid immunity now, and but I think the majority of the population actually is just like sort of expecting too much protection from the vaccine, so they really need to like tune up their own organism a little bit more to help support resilience.
Exactly. It's the terrain more than the organism. It's how your body. That's why you can be in a home. The average person, if you have a family that gets COVID, 1 out of 6 will catch it. The others won't. And so it has more to do with your own immunity. Get sleep, stay hydrated. I use something called ViraPro, which is a wonderful mix of nutrients and other herbs that will help go ahead and help the immune system. I had COVID. It was a wonderful 4 days. I stayed in bed, drank tea, and read my Kindle. And it was like no big deal. So it's a mix of both. But we focused on the vaccine and on what you'll find in the media is if it supports their advertisers, which means if it's very expensive, it will be the pearly gates are opening and the horns of heaven if there's the tiniest bit of benefit. Anything negative will be suppressed till the patent wears off. And if it's positive about natural remedies, it will be suppressed, attacked, or misrepresented.
Well, and I think people are always looking for a quick fix, easy solution. I mean, we see it with weight loss. They want a diet pill, or they want a miracle, cabbage soup diet or something that's going to solve their problem immediately. And when you say to them, the solution is to, cut out some of your carbohydrates and eat less and space out your meal and move more and reduce your stress and get enough sleep and all of those things. I don't want to hear about all of that. And it's the same thing with COVID. Vaccines can play a role for some people, but the bottom line is you need to be getting your rest. You need to be eating well. You need to be keeping your stress in a managed way. You need to be focusing on your other health issues. If you have, gingivitis and 5 other infections in your system raging, well, your COVID's going to come looking for you. Whereas if you're somebody who's super healthy and taking good care of yourself and doing what you need to do, even when you encounter it, the likelihood that your immune system's going to go, come on, here we go, welcome home, is, you're in much better shape to defend yourself against anything. And that includes cancer and diabetes and thyroid and autoimmunity and COVID and the long COVID implications. So I think that's always the message that we always come back around to with our thyroid patients too. And, Andrew, I know you got to tell people, I mean, one of the things people will say, I'm so tired, fix my thyroid. And I'm sure you've asked them, but all of you, how much sleep do you get? 4 hours a night. Of course you're tired. I mean, there's no thyroid hormone in the world that somebody can give me that's going to make me not tired if I'm only getting 4 or 5 hours a night. So some of this is common sense that we need to keep in mind. Some of this is also some of this groundbreaking look at the interactions of the hormones and the immune system. So here's a question from one of our viewers who wants to know, if you have COVID, and you're recovering. So, and we don't always know, but a lot of people that get long COVID don't have very difficult course with COVID. They get it, they do fine. They get, they have their sniffles, they go to bed for a few days, they get back up, they go back to it. And it only starts to dawn on them that they have a problem months later. So somebody who's going through COVID, they've gotten COVID, they're getting it, they're recovering. What do they start looking at that point in terms of ensuring that they are going to shore up their immune system and possibly reduce their risk of getting long COVID? Do they focus on the adrenals or the thyroid? And if they do one or the other or both, which one first? So Jacob, do you have some thoughts about that?
Sleep and rest. I find that the people who try to work through, they have deadlines at work and they can't stop and they try to push through the COVID, are the ones who get post-viral chronic fatigue syndrome. That's what my case was in med school too. I was in med school. I was working full time to pay for med school. And those were the two easiest things in my life that were going on when the virus hit. So rest, hydrate, sleep. Make sure your zinc and vitamin D are optimized. Again, the ViroPro is a good way. They're good multivitamins. That'll make a big difference. Just simple measures like that. Be gentle, rest, and let your body heal.
Mm-hmm. And
the body's innate abilities, harnessing the body's innate abilities is going to be more powerful than anything we can exogenously from the outside put into somebody.
No, I want to poo.
Now, Andrew, Andrew, let's say you have a hypothetical patient who contacts you and says, look, I just have had COVID. I'm feeling a little bit better, but I'm still really dragging. Is that going to trigger you to talk to them, to check their thyroid levels, to see if things have gotten out of whack and possibly to change up their dose, or are you going to wait a certain amount of time? What's your thinking about that? How would you approach that?
Yeah, it's a great question, and it maybe will change a little bit as I move forward with this and learn more about this. I mean, there are a lot of people who in the 1 to 3 month post-infection period who will be much better at the 3 month point than they were at the 1 month point. So I don't want to sort of jump in and overdo it, like at the 6 week point or something like that. Mm-hmm. Personally, this is a style thing. And I mean, I'm the same way. If I see somebody's labs go a little bit off, I try not to be reactive and then adjust their medicine. And then the next one comes back and I shouldn't have done that or whatever, So as I've seen people more longitudinally, I've tried to be less reactive to lab results and that kind of thing. But yeah, I just don't really have experience like the way Jacob may of being like, oh, okay, somebody is in this kind of subacute period. Maybe I'll bump their thyroid hormone to help them through this. And he's shaking his head that there's not a simple answer in that way. So I think it depends on how they're feeling.
I'm agreeing with what you're saying. You're showing wisdom. You say you haven't got much experience, but you're acting like you do. You're realizing the low thyroid test may be telling the body rest. It's not saying take more thyroid and override that your body is putting it out to ground and making you rest. After 3 months, that's a different story. But on the first 3 months, your body's wisdom may be making the thyroid test abnormal. Rest.
Interesting. That's an interesting idea. We have one or two last questions coming in from our viewers. And this one, I'm going to open it up to either one of you because this is a good question. And I don't know the answer to this. Can COVID affect your blood sugar?
Absolutely.
Okay.
In both directions.
It can make it go up or go down?
Right.
Yeah, cortisol mostly, or what?
Yeah, well, largely with cortisol as a main mechanism. But the stress driving cortisol up can drive the blood sugar up,
Okay.
and exhausting the adrenal because the hypothalamic pituitary axis dysfunction or just the stress can cause the blood sugar to go down. So yeah, I can go both ways.
Okay. All right. And then our last question, and I think we're going to want to hear from both of you about this, is the how do we improve physician education to get proper treatment and I would say for both post-COVID or post-viral syndromes that we're talking about, and also for hypothyroidism. Andrew told us about his focus going into med school of being interested in integrative, holistic approaches. Jacob, had certainly an experience during med school that caused him to change direction and move into a completely new field of study for him. But how do we get more doctors on board with the kind of understanding of how we're approaching thyroid and post-viral issues here, like the two of you do? So, Andrew, I'm going to let you take this one first.
I think it's hard because as a patient, you really don't have a tremendous amount of influence over what decision making, strategies your doctor uses. But I do think that bringing engagement to that partnership and letting them know that you respect their opinion and that you would like to understand more about why they may be more maybe limited. And a good example, right, is like a lot of people come to see me and they're like, I really want to take Armor or NP thyroid or something, but my doctor in this particular area of the country or whatever, they refuse to do it. Well, it usually comes, if you can recognize that it usually is just coming from a place of inexperience, and maybe that doctor doesn't actually have a good knowledge base about like how to use T3 or how to use desiccated meds because they just weren't educated in it. Then, if they have patients that are requesting over time, hopefully they'll get the message. They should learn more about it. I mean, for me, I didn't prescribe low dose naltrexone earlier in my career because I just didn't know enough about it. I heard about it on podcasts and so forth. Same with T3. I mean, I wasn't really educated much in it. At some point, you just have to sort of jump in and start getting anecdotal experience, which informs, our practice styles over time. But luckily, I think, integrative and functional medicine education is improving. It's becoming a little bit more standardized. Now you can get board certification and unfortunately the duration of appointment times is not also getting longer so that people can have better dialogue with their patients. But that was a little bit tangential answer, but okay. Hopefully there's some pearls in there, right? Open communication, I guess an attitude of partnership and inquiry and curiosity is one of the best ways that like both sides can approach it.
Okay.
And if you go to the doctor, it's okay to ask for desiccated thyroid. You try the T4. If that doesn't work, you say, can I try the other? I've heard from a number of people that it helps. If they say no, you need to respect that. Otherwise, it's like going to me wanting heart bypass surgery and saying, I want bypass. I say, but I don't do that. I'm not comfortable with that. I say, here's a book for bypass the fantastic and a scalpel. It's like, go to somebody that this is what they do and they know. So go see Andrew at Paloma. I understand he'll talk to you on the phone. So even if you're a distance away, see folks that this is what they do. Find holistic doctors. This is what they do. But and how you can affect your earlier doctor's decision making prospectively for yourself. Once you ask and they say no, you're not going to generally. But once you take it and you find, I feel so much better on this, write them a note because they do care.
Let them know.
And say, I just want to let you know, because I know you care about your people, that the regular thyroid wasn't helping, but I took desiccated, or the desiccated wasn't helping, and I took, the T4, whatever it was, And this helped me get better. Just thought you'd like to know. Thanks. That's all. And they get a couple of those letters, their minds may open, but you're not going to browbeat them into it, nor should a doctor do anything they're not comfortable with.
I agree. And as a patient advocate, I'm going to add in that if you are going to spend all of your energy trying to educate and convert your doctor, you're wasting your time. And some doctors don't always like this, but I always say to look, if the plumber comes to my house 5 times trying to fix my sink and he still can't fix it, I say, thank you, Mr. Plumber, and I get a new plumber. If my doctor is going to keep telling me I can't fix this and I don't want to figure out how to fix this for you, it's not my job to teach him how to fix a sink. It's my job to say, thank you very much, Mr. Plumber, Mr. Doctor, I'm on to a different doctor, because life's too short. I can't spend months and years and decades waiting for a doctor to see the light. When there are doctors out there like Andrew and Jacob and our Paloma doctors and many other doctors out there that actually do understand, they're already up to speed. We don't have to wait for them to get there.
Yeah, you don't want to teach your doctor how to do heart bypass surgery? Oh, Mary.
No, not me.
You want to go to somebody who actually knows what they're doing, yes.
We're going to be wrapping up shortly, but we do have 2 more questions that came in while we were chatting. And I think we're going to go ahead and take those 2 questions, and then we will finish up with our session today. This one is really a general question about inflammation and immune function. Somebody wants to know how much fiber, insoluble and soluble, do you think is recommended to create better gut health as a way to help us improve our immune function and lower our inflammation? Andrew, do you have thoughts about that? Is there a one size fits all fiber formula number that we need to know, or is this something that's more customized for people?
I think it's more personalized. I think fiber is highly underutilized as a supplement in medicine. Honestly, since I started doing more gut health work, I just have been amazed how many people sort of, A, it feeds the microbiome. B, it can regulate diarrhea and constipation both. Obviously, we want to be getting most of our fiber through, phytochemical rich foods and stuff like that, so that, it's playing double duty. But the balance between soluble and insoluble, it depends on somebody's gut milieu a little bit. Like, some people don't tolerate insoluble fiber as well. There's a lot of different types of fiber out there. Many of them have a mix of insoluble and soluble. For people who are sensitive, sometimes I start with ones that are more soluble, like acacia fiber, or, I think modified citrus pectin is a little bit more soluble fiber. So it takes some trial and error and some playing around with the dose to kind of titrate it to like the bowel movement, pattern that makes somebody feel good is what I would say. So I don't think there are recommendations about goal numbers. I often hear 25 grams and things like that, but how many people are like counting how many grams of fiber they're getting in their diet? I don't know. I just throw some extra fiber in my smoothie.
Yeah. Jacob, do you have any thoughts about fiber? And do you feel like fiber is very important to immune health in general?
Of course, because gut is important to immunity and fiber is important to gut health. But basically what Andrew said, but in terms of grams, what an annoying way to spend the rest of your life. Kind of grams of sugar, grams of water, or ounces of water, grams of fiber. And how many times should you say hello each day? And see what feels best. You eat a diet that's a healthy diet. Your body will tell you what works for you and what doesn't. And that.
It's safe, play around with it.
Yeah.
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 Okay.
Basically what Andrew, what you said, he nailed it. So.
All right. We have one last question, and then we're going to wrap up from this really fascinating conversation. This is somebody who has long COVID and said, should I be exercising with long COVID? This patient is working with a trainer to build strength and muscle, but gets tired very easily despite taking it slow. And I mean, this is a question that Jacob, I know you've heard from fibromyalgia patients, chronic fatigue patients. We've heard it, Andrew has heard it from hypothyroid patients and Hashimoto's patients. You know, I am exhausted, and even when I exercise, I get so tired. So Jacob, can you start us out with this? What's your thoughts about that?
Yeah, there's a concept, or not a concept, there's called post-exertional malaise. And what it is, remember, these are energy crises, CFS, fibromyalgia, where your body's only able to make a certain amount of energy. When it's post-viral, it's often because the body has shut down energy production to prevent the virus from hijacking the energy machinery of the cells to make more viruses. It's purposely starving down the energy production, but then it has trouble turning back on. And the thing is, most people, if you exercise more, your body conditions. It says, well, we're going to need to make more glycogen energy stores to go ahead because you're doing that. But in these post-viral conditions, you can only condition to a certain point. There's only so much energy your body can make. Beyond that, instead of conditioning, you crash. So if you feel good tired after and better the next day, that was a good amount of exercise. If you feel like you're bedbound the next day, it's too much. Stop for a couple of days, cut back by 20%, leave it there. As you do the SHINE protocol, optimizing sleep hormones and addressing infections, nutritional support, exercise as able to maintain conditioning, then the energy producing machinery goes back on. And after about 10 weeks, you're able to start making your energy skyrockets and you can start conditioning. But if you try to push through where you feel next day fatigue, feel worse, it's not helping your body.
Okay. Andrew, do you have thoughts about this in terms of people really pushing so hard and trying to over-exercise possibly, and the impact on the immune system, the adrenals, thyroid, the whole bit?
No, I agree with Jacob. I mean, he's the expert on that topic, really. I can attest to recently, you know, I traveled before Christmas, came home. My entire family was sick with various things from traveling. I was sick for most of the end of the year, just with a respiratory infection. It wasn't COVID, but I had recently, prior to that, had really good traction with an exercise plan and was kind of bummed out that I was tired enough that I didn't feel like exercising during that period. And so I didn't. And then I got better and I got back to exercising and I sort of was able to pick up where I left off pretty much, probably because I didn't jump into it too soon.
Mm-hmm. Yeah. Well, one of the things that I'll always tell thyroid patients too, when they're really tired and they know they want to work out, they want to try to lose weight, they need to move, they want to get more energy, but they said, I went to P90X class, 90 minutes of I'm like, no, that's not going to help. I ran 5 miles. No, I tell people, look, that, you baby steps in some cases.
Visualize that.
Yeah. It's not, or just use some stretchy bands and build a little muscle, or do a little floor Pilates, or just do a walk around the block and see how you feel about that. Take it slow and work more on muscle rather than aerobic running and jumping and, running around the neighborhood, because it can be especially exhausting. I know it is for me, and that's been my experience. So it sounds like we've got some really good ideas here. And I'm blown away by this conversation. I have to say that I've just really enjoyed sitting here having a conversation. I wish we'd had coffee and wine to go with it. And we were all on Jacob's patio in Hawaii for this conversation.
I know it got dark here while I was talking to you.
Exactly.
I've got the tequila. I'm ready to pour.
Here too. Yeah. So in any case, this is so much great information. And I just want to mention that people can find Andrew on Paloma Health. So if you are in Colorado, are there other states where you are available, or is it just Colorado, Andrew?
I'm available in most of the state. I mean, I'm actually licensed in the whole country, and Paloma is available in a lot of states, and
Fantastic.
many of those I see patients. And so,
So
my
Andrew if you want to work with Andrew, you need to just contact us through Paloma Health, and Andrew may be able to be your next doctor. And I know that there's probably people lining up already interested in that option.
I think highly of my colleagues too, though. So if you can't get in with me,
absolutely. I mean, we're focusing on Andrew today because he's our Paloma star today. But we have an incredible team of Paloma providers that are all around the country, providing a variety of approaches, and but always the approach is about getting patients well and treating hypothyroidism so people can feel well and live well. And Jacob, can you remind us again, and we'll be putting this out in a replay email follow-up, and you'll be able to get all that information, but remind us where people can find you as well.
Well, again, after 50 years in medicine, I retired last November from patient care, and now I'm focusing on the teaching. My email address to get the free information sheets is fatigue.doc, like fatigue doc, @gmail.com. Some of the supplements I find best, endfatigue.com, E and like Nancy, D like David, fatigue.com. For information on how to recover, vitality101.com.
And I would also add that one of the things that's always been unique to me about Jacob's approach is he has always put everything he knows in his books. You just have to read them. So the Fatigue to Fantastic book essentially outlines and provides a great amount of detail on the SHINE protocol that Jacob discussed today, his protocol for post-viral conditions, including the COVID. And his website also has some additional information with some new findings and such about COVID. But I would say get a copy of Fatigue to Fantastic. Go check out Jacob's websites for information on the bigger picture post-viral issue. If you need a really great thyroid doctor, contact us at Paloma, and you might even get Andrew as your doctor. And so I want to say thank you to everyone for an incredible conversation. And I am going to turn it back over to Alex from Paloma.
Guys, that was such a great conversation. I just feel like I need to share. First of all, we have some patients from Dr. Cunningham saying, "Thank you, Dr. Cunningham, here to support my favorite doctor, saved me from years of health issues." So I just thought that was really important to share. And everybody's so grateful, Jacob, of all the knowledge you've shared and everything. So really great conversation, guys. Again, just to wrap up, everything will be available via replay. So if you registered for the event, you'll get an email. But if you did not, you can go ahead and, well, if you're viewing this, you've obviously found it somewhere. But it's going to be on our website. So you can go there or on our YouTube channel, and you can always watch it anytime you need to kind of refresh or go back and refer to things. So I just want to say thanks again from Paloma Health and all of our special guests here, Mary, Andrew, Jacob. I really appreciate your time. And this was a great conversation, guys. So officially signing off, and thank you guys for attending.
Thanks, everyone.
Welcome.